I am Ashrafullah Misty, Executive Director of Women with Disabilities Development Foundation, WTDF. WTDF is working for the empowerment of girls and women with disabilities across the countries. I have some observations on what immediate and transformative actions are needed from persons with disabilities perspective to accelerate progress towards Agenda 2030. Current health system are failing to include persons with disabilities, especially girls and women with disabilities. The service on sexual and reproductive health rights, communicable and non-communicable disease of disabilities are not available in Upazila Health Complex. Bangladesh government run community clinic for community people, though that also not accessible and affordable for women with disabilities. Attitude of health professionals towards women and girls with disabilities are not adequate and professionals. We have so many examples. One of the example is that the spinal cord injured people who got disability under road accident and falling from high level or wrong treatment or natural disaster or wrong treatment for baby delivery period. If people get in spinal cord injured, not have medical treatment facilities except going to capital city, even though there are only 3 medical colleges or hospital like NITOR, Dhaka Medical College and Bangabandhu Sheikh Mujibur Rahman Hospital have only the scopes to get service, but there is no rehabilitation program in built. Spinal cord injured people need to go Center for Rehabilitation, Center for the Paralyzed as a non-governmental institute. So in government level there is no health facilities for the spinal cord injured people at all. We have lots of cases in country when women with disabilities get pregnancy, they don't have service from existing hospital. Doctors and health professionals misbehave with them and treat as bad as much. As the delivery bed is fixed on higher level than wheelchair, so wheelchair user mother can not pass themselves to wheelchair to delivery bed by the assistance of the health professionals. They are forced to climb up to delivery bed by their own. So it is very danger at the pregnancy period to transfer themselves wheelchair to delivery bed as it is high. It is very often wheelchair user mother become harassed a lot, and here why they become pregnant, why they conceive, how they will care their baby, etc. Hearing impaired girls never get services as because the hospital, community clinic, private clinic not have sign language interpreter system, cannot communicate with doctors and patients. So they often used to go local pharmacy where family members have access to buy medicine without consultation with doctor. So women who have hearing impairment, they are in the low segment that they don't have medical facilities at all. We have advocating to get services from door level and also for all types of people with disabilities from the government services. Government of Bangladesh try to make some changes in the policy level through our advocacy. For example, Bangladesh government include standard operational procedure for inclusive reproductive health service for girls and women with disabilities, where Sri Lanka, a visual impaired woman, was associated as a consultant, include disability services in the standard operational procedure on inclusive reproductive health services. Another example, community clinic on the positive is one of the positive initiatives of government to provide service at the community level where community people have opportunity to get services from and avoid long distance. But this community clinic not have all facilities and disability access at all. So we always encourage government and non-government stakeholders who are associated with providing health service should have priority setup, and inclusive health service is essential. It is very important to ensure qualitative health services for all, to multi-stakeholders, gender-based, gender-balanced and intersectional approach for transformative actions to advance progress on the implementation of 2030. Universal health coverage can be achieved if health related information and services are available for people with disabilities regardless of their age, gender, socio-economic status, etc. Affordability of care Affordability of care is a significant obstacle. People with disabilities tend to be poorer, have higher healthcare costs, and more likely to experience catastrophic health expenditure than non-disabled people. Physical inaccessible of health facilities and problems with the transportation can also present significant logistical challenges. Thus, facility must not inclusive and accessible to everyone. Better data is needed, including routine health metrics and information on the health coverage disaggregated by disability. In the medical college and hospitals, they have health registration systems, but there is no indicator to include disability issues and people with disabilities. How many people with disabilities get services from the health service providers, hospitals, medical college not have recorded. Disability awareness should be a core aspect of health professionals training. Reasonable adjustment such as longer appointment of patients with intellectual disabilities or awareness of communicating with people with visual or hearing impairments are very much needed. SDG goals and the promise to leave no one behind cannot be realized without include people with disabilities from poverty to inequality, climate to health. While SDG include persons with disabilities, this does not fully extend into the monitoring. Only 7 out of 169 targets especially address disability inclusion, and only 10 of their 231 indicators especially requires disability data disaggregation. This is only focus on the health services. What about the education, employment, recreation, housing, food, and accessible cities? There is lots of barriers and challenges faced by girls and women with disabilities, especially because they don't have assistance systems, caregiving systems in our country. So girls and women with disabilities often face more 10 times discrimination against women or men with disabilities. Inaccessible communities, inadequate behave, and the non-supporting society makes more barriers for girls and women with disabilities empowerment. So we always argue that equal citizens' rights is the rights of persons with disabilities, especially women with disabilities. And women with disabilities not only get the facilities and services from the government, they want to serve, they want to contribute in the economical progress of our country. Thank you so much for listening me.